Begin recording.
Started.
Thank you. So, good morning, everyone. This is the MnCHOICES MCO and MCO delegate call-in session for October the 18th. Welcome and good morning. My name is Teresa Vanderbent, and I am the host for today's call. And on this slide are the list of potential MnCHOICES team members who are attending. Please know for today's session, Rakia Banya, Sue Kamendru, Deb Maruska, Kathy and Tina are on the call today, so just so that you are aware, they're here to support us. This session is being recorded. We use web audio. You can use it to listen to the session. You are all muted to guarantee we don't have background noise. And when you have a question, you will raise your hand. That will put you in the queue, and then we will call on you and unmute you. We'd prefer you don't put questions in the chat, but if you do put questions in the chat, we'll capture them after. We would prefer you ask your questions out loud. Gives us a chance to have a conversation with each other back and forth and make sure we understand the question as well as can answer it in a method that helps you understand what you have a question about. So conversation is preferred. So our agenda isn't very large. We are going to have a few things to walk you through. I think there are 3 or 4 slides. And then the rest of the time is really there for you to ask your training questions. So I'm going to go ahead and get started, and we will have a back and forth of sharing the screen just to make sure that you get a chance to have your questions answered by having someone going in the system and showing you. So let's go ahead and start. So let's go through the few items. So first thing I want to make sure that people are aware of is we're seeing for managed care and specifically that mentors are submitting a contact form in for the person. And so they're actually for their user putting their username and the contact information. And we would request you to no longer do that. We want you to put the mentor name in the contact information. Are you submitting this form on behalf of someone? Yes. And then put the staff person's name below. We really are only supposed to be taking help desk tickets from mentors. And so if we see a person isn't a mentor, at some point we'll start saying, hey, please have your mentor submit this in. And so we don't want to turn away people's requests for or questions. So please fill this out correctly. The other piece I wanted you to be aware of is person ID. This document doesn't have a place for a person ID, but it is most useful to us because we can't search for document ID, which is what the form currently has. So if you can put the person ID in with any of your requests when they're specific to a person's case, that would be most useful. The other piece that we're, and you'll understand this because you get it back from us as well, is you'll say, hey, this is happening to most users. And as much as that, you may think, hey, that will help us for us to know that it's widespread. You can say that comment, but also kind of talk about, here are 3 users specifically, and here's what's happening to them. Because otherwise we have to assume, which gets everybody into trouble. And then secondly, we're also seeing a bunch of tickets coming in that could be resolved if the mentor sent the person to the current functionality document and had them look up the workaround themselves. And so again, you may hear us say, have the person use the current functionality document. And we would really prefer that if you know that you get familiar with the current functionality document, and then you have your users get comfortable with it too and have them use it, because that will lessen the amount of help desk tickets in for things that really need to be addressed by us. And that is our preference because that means that we respond back to you. So that should also then be your preference too, to get a more speedy response from us. So this next one, Kathy, I believe, do you want to first cover the content and then I think we're going to have you share in the system. Is that right?
Yeah, that sounds great. So the first one, primary care physician contact information. So we received some feedback about some things in general that people were having trouble with. So I am going to share my screen here.
Yeah, and then Kathy, if you want me to, I can remind you which each of the bullet points are for the PowerPoint so that you don't have to go back and forth.
That would be great. You're just reading my mind. Okay. So I'm going to do one thing quick here, and then I'm going to share.
We can see your screen.
Awesome, thank you for that.
So the first one is primary care physician contact information.
Yeah, thank you very much. So right now I have my person up, and I'm in their profile. And the question was about, like Teresa said, entering the primary care physician contact information. And so you would go into contacts, and there is, I'm going to look here to see if I have a primary care physician, but you would enter the information like a contact. And so I'm going to, so down at the bottom here, I have a lot of contacts because I was doing a lot of, sorry for my scrolling. Down at the bottom, you add a contact. But I actually have one already added. And actually, maybe I'll just go here so I don't have to scroll so much. But when you're in the contact, you can put the clinic name. So for, maybe it's an Alina clinic or Health Partners clinic. You can put the clinic name, and then you can enter the doctor's first name and last name. You can indicate their specialty, and then also if you want them on the support plan as part of the care team or the interdisciplinary team, you would click that. And then you can enter additional information also. I'm going to click save here. But
Hey,
I'm going to
Kathy,
also, oh, go ahead.
can you do me a favor? Can you go back to that edit for a second?
Sure.
And just show them the relationship
Sure.
type drop down? Because that's where they're going to pick, so they'll know
Oh, sure.
which one they should pick, right?
Mhm.
Thank you.
Yeah, there's the drop down here. What I'm going to show you is in the support plan. So to get to the support plan, I could go here to forms. What I also want to demonstrate while I'm here is the split view. My colleague Rakia reminded me recently that the split view, it was not working when we first launched the system, but that has been fixed. And to be honest with all of you, I forgot about that. So Rakia reminded me. So I'm going to show how you can use the split view. And it does make it a lot more efficient. So the other way you can get to the support plan too is using split view. And then we go down to forms. And then I'm going to open the support plan to show you how that contact will look in this support plan. I'm going to go to edit.
And Kathy, part of the reason why you're doing this is because if the support plan data isn't showing up or isn't showing up correctly, you can go to profile and change it and then go back to the support plan.
Right. Actually, I think this may end up making me do this. Oh, it's actually going to work okay right now. So this is not the doctor that I filled out in the context, but since this is here, I'm just going to show everybody. Does this pop-up show, Teresa? Or do I
Yep,
have
we
to
can see it.
reshare? Okay,
Mhm,
okay.
we can see it.
So when you go, if you want the doctor's phone number to show, the doctor's phone number does not pull from the contact field in the profile. You have to go under comments and put the doctor's name and phone number here in the support plan. So we weren't sure exactly what that question was when we got it. So I just wanted to demonstrate a few different things that you need to do. One, you enter the doctor in the profile under contacts. And then when you put the doctor in the care team, then you have to go in comments under the doctor and put his phone number in.
And the benefit of split view here is that you could, if you couldn't remember the doctor's phone numbers, you can go to profile, look it up, copy it, put it in the
Right.
support plan because they're running side by side, right?
Exactly. Exactly. Yep. Teresa, while I'm here, I might show something. Can I jump down to the bullet point about having the first name and last name in there?
You do it in whatever order you need to do it in.
Okay. So what I'm going to do though is I'm going to go out of split view just to make it more obvious. I'm going to go to edit. I'm going to go to my care team. Another thing that was happening to people is when they were adding their support team, did this pop up that says add support team member come up? Can you see that, Teresa?
Yep, I can. Sorry.
That's okay, no worries. So when people were going to add this support team member, they were getting this issue here where it just continues to spin and spin and spin and says options are loading, but they never load. The reason that is happening, I will demonstrate here. I'm going back to the profile, back to contacts. Sorry for the scrolling. And the reason it's happening is there is no first name and last name listed for this organization. As you can see, when I go down here, there's a first name and a last name. Case manager, or the son's name is Alfonso. There has to be an entry in the first name and last name. If you have any contacts, and I'm going to go into this and show you how it looks as you're entering it. You can see here there's no first name and last name in the contact field, because it could very well be that you don't know the first name and last name of somebody. You may not have a specific contact for High Street organization, but what you have to do at this point, and this is something that we are going to fix, but it's a more global issue than just here with contacts. So it is going to take us a little while to get this fixed in the system. But in the meantime, you have to enter something into this first name and last name field and save it. And then you will see, sorry, I went all the way down to the bottom now. You will see how now this has an entry. What is happening in the system is if any of your contacts are missing this first name and last name, when you go to your support plan and you try to enter your care team, it will not allow it. It will not pull any of your contacts. You will get that spinning notice. But now you can see I entered High Street Organization in first name, last name, and now all of my contacts are now loading. So I just wanted to demonstrate that and kind of get that out of the way so that now it'll be easier for me to demonstrate other things. Teresa, can you please tell me what's next on the list?
I have emergency contact. So it says does not have a place for a phone number identifying the DD worker and not pulling the care coordinator name as well, it says.
Okay, so it's very similar. And actually I'm going to go to split screen for this because I think this is a great example of how split screen will help us. So it's a very similar situation to what I showed you with the doctor. So if you wanted to have, what was the first one, Teresa, not the DD worker or care coordinator, but what was the other?
Does not have a place for phone number identifying the
Yeah.
DD worker. Okay.
Okay. So it's the same thing. The question was what we believe.
Actually, I think it was emergency, the emergency contact.
Emergency contact. Okay.
Yep.
So it's
She's
emergency
showing it right here.
contact first. Okay. So same thing. So over here on the right hand side is the profile of the person. On the left hand side in split view right now I have the support plan. So I'm going to go in here down to contacts again. And I'm going to use Alfonso because he's already set up that way. But you can see where he is the emergency contact. So again, you can edit that. You can enter information in here. The thing is, even if his phone number is in here under emergency contact in the profile, it does not automatically load into the support plan. So what you need to do is, again, on the left-hand side of the split screen, I have my care plan, and Alfonso is in the support plan. As well, in here I have relationship is the child, stepchild. And then if you want the emergency contact to be in his phone number to be in here, you have to type it into the comments section, and then you'll have the phone number. It would be the same thing for, having the DD worker, but the care coordinator name isn't pulling. Again, let's see, if I'm over here on the right side, I'm in the person's profile. I have the case manager listed, but you could put the care coordinator here in the contacts or case manager. Again, organization. This is, you pick the relationship type. If you want them to show up on the support plan, you would pick it so that you can choose them as the interdisciplinary care team. Again, here is the emergency contact selection. And then when you're looking at the support team and you're adding a person, if you want their phone number in here, you just add their phone number. So that would be for anybody, a care coordinator, an emergency contact, primary care physician. Just make sure that you add it on the support plan, and then it will print off.
So Kathy, what I hear you saying is if they would like their name to show up on the support plan for, as care coordinator, they would add themselves as a contact, pick themselves to be part of the interdisciplinary team, and then make sure their phone number's on the comment section. Am I hearing you
Yes,
correctly? Okay, thank you.
that is correct.
And that would be the same for any other worker that they would like to display. So, in
Yes.
this, okay, thank you.
Yep. Are we taking questions now, Teresa, or at the end? Or I
Let's
thought
take
I
it.
saw.
Let's take it at the end. The next
Okay.
one I had on your list was guardian and informal support.
Okay. Yeah, I think Rakia is going to speak to this one also, and I can demonstrate while Rakia is speaking to it. Is that okay with you, Rakia?
Yeah, so are we talking about the multiple roles
Yes.
that a person might have for one of their contacts? So
Mhm.
we've gotten a few questions about if a person's contact has multiple roles. So let's say they're the person's guardian and also they're the person's parent. If you look at this relationship type drop-down menu, you'll see that it's only a single select option. So you're only able to choose whether they're the guardian, but it won't allow you to also choose if they're also the parent, or same as if they're the person's informal caregiver. Like, it will only allow you to select one option. So one way, well, two ways. There's two ways you can go about doing it if you want to be able to pull that contact into the person's assessment or support plan, is that you can either indicate that they're a guardian and then use the comment field at the bottom to note that, you know, this person is also the person's mom or parent. So you can use that note field at the bottom to indicate that they're also the parent. Is one way to do it, because then when you go into your assessment or support plan and it asks for the guardian who was there, it will pull this contact. Or another way that you could do it is you could enter the contact twice. So you can enter the contact as being, you know, the parent. I might be going too fast for Kathy.
No, you're
Sorry.
okay. No, I listed him as the guardian there, and
Okay.
then I can list him again. I just have so many contacts in here. It took me a while to scroll. I'm sorry.
Yeah.
But then
So
I
you
can
can
also, yep.
Yep. So you can indicate that they're the guardians. You can enter them as a contact as a guardian. And then for one, and then you can save that record. And then you can also create or add a new contact to indicate that they're also the person's parent or informal caregiver or parent as this option. And then you could still use that comment box to indicate that they're the same, but this would allow you to be able to pull the contact into the person's assessment or support plan form.
Oh, I
Yeah, you'll have to
add
fill
a
out your
whole,
address, but
yeah, it wants my address, so
yeah.
I can skip that, but yeah.
Yeah, but it just kind of provides direction on how you can
Yep.
enter a person's contact twice so that they could pull into the person's assessment or support plan forms.
Thank you, Rakia.
Thank you.
So the next item that we had, Kathy, was how to revise a support plan. So
Sure.
um,
I'm going to go off a split screen for this so that I have the whole screen to show you that. So let's see. I do have one that's approved here. So when you're going to revise a support plan, so the question was, you know, if something changes with the person that they want reflect throughout the year that they want reflected in the support plan, how do they do that change? And the functionality in the revised MnCHOICES is that you have to do a revision of the support plan. So in order to do that, you go to forms. And then you have to go to this filter button. I think that we call it the tornado button because it looks like a tornado, but this is a filter And I think that trips people up, is if they don't first filter. And then I'm hoping this box popped up and that you can see it.
We
And then
can.
wonderful. And then you pick support plan. And it'll pull up all of your support plans that are in the system for this person. I obviously do a lot of testing, so there's a lot of things in here that probably don't make sense. But then you go here and you can see, hopefully this pops up too. And it says open record or revise. And
So
you would
Kathy,
s-
before you do that, please note that she chose the plan approved. So a plan
yeah.
has to be in plan approved status to do revised. If it's
Yeah,
in
thank
any
you.
other status, you cannot revise it.
That's a really good point. Thank you, Teresa, because as you can see, I have several here. And if I went to this discarded one, you can only open it, you can't revise it. So it has to be plan approved, and I selected this plan approved, and I went down and I select revise. Is there more? Oh, go ahead, Teresa.
Nope, I didn't have anything else. Let me see. Nope, that was everything on your guys' list of things you wanted to cover.
Okay, that sounds great.
So,
Thank you.
the rest of the time, folks, is for your time to ask questions. We originally had it so that you would do health risk assessments and support plans as the first group of questions, and then the next one to be assessment and support plans associated with them, and then all other questions. Does that still work, Rakia, to do it in that order, or do you have a preference to do the order any differently?
I don't have a preference.
Okay,
I see
so I'm gonna.
we already have some hands raised, and so
Okay, so we'll just
I
take
don't
them
know.
then. Okay.
Okay. All right. So the first question comes from Veronica. Veronica, I am unmuting your line.
I bet she didn't think we were going to be calling on her right away.
Okay, I see that she lowered her hand. So the next question we have is from Sheena. Sheena, your line is unmuted.
Hi, so I have a question in regards to if a member is on a DD waiver, but so we are only doing the health risk assessment for them. I have it in here so that the contacts, I have the case manager listed as the county case manager and then myself as the care coordinator. And then when I completed the support plan, on the support plan, it's saying that the care coordinator, and it pulled the county case manager's name.
So
even though they're correctly listed in the profile.
So can I ask you, I think this was one thing that I was going to show. So I apologize. Is it listed outside of the care team? Is that what you're saying? It's pulling that name, but it's not inside. Teresa, I'm going to share again, Teresa.
We are listed.
Yep, please do.
Yeah, we are the interdisciplinary care team.
Yep.
And so I don't know if that's the reason for it, but it still just pulled her name or the county case manager's name.
Yeah, so can you see my screen again?
Yep.
Okay. So I'm going to show you, I'm going to ask you if this is what you're referring to, and I appreciate you bringing this up because I meant to talk about this. Actually, I think what I need to do is show a printed version, and then I'm going to ask you.
That it's pulling incorrectly.
I'm sorry.
It's on the printed version that's pulling incorrect.
Yeah. Okay. Let me ask you, just for a little clarification, if this is where you're seeing it. Are you seeing it here?
Yes.
Yes, okay. Thank you so much for reminding me. That was perfect. So what this is whoever creates the support plan, their name is being pulled in here. So if we have some organizations where they may have a admin staff or support staff that are creating support plans, and what we found is what has been reported to us, and what we found is whoever started that support plan, their name is here, even if it's not the care coordinator. We are looking into that. In the meantime, what you would need to do is remove that person's name on the printed version and put the actual care coordinator name. So I appreciate you bringing that up. It is something that somebody reported to us. We are working on it. And that is, the system was built that whoever started the support plan, that is being pulled here.
Okay, and I just have one follow-up question with that then. So when we did the assessment, I believe that the DD case manager still did her assessment the old way, and I did mine in MnCHOICES. And so I created that support plan and it still pulled her name. So is it that whoever creates the support plan or whoever like opens the case or, you know, adds the case to their caseload first? That makes sense.
I understand what you're saying. Unfortunately, I don't have an answer. Have you submitted that one as a help desk ticket?
The question, well, I think my supervisor is the one who submitted this question.
Okay.
Sheena, can I also ask you a question? This is Rakia. I do have a follow-up question. Do you know if the assignments, if your assignments tab was filled out prior to the support plan form being created? So did you indicate the
Yes,
assignments? It would have been. Okay, yeah, I don't know if this is the same one.
Yeah,
or Kathy, if you have more to say, or we can look into it more.
I don't have a ticket on this one. So I guess what I would ask is, if you could check with whoever's supposed to be submitting tickets for you, if you could check and make sure it was submitted, because I do not have one on this. This is different than what I had. The one we had, it was a support staff that had created the support plan. And the support staff's name is there instead of the care coordinator. I don't have one where the assessor's name is there instead of the care coordinator. And you're saying the assessor did not start the support plan?
Correct. No, I started the support plan.
Yeah, could you please submit that? Because that is
Different.
different than what.
Yep.
Yeah, thank you so much.
Okay, I will do that. Thank you.
And hey, Kathy, when that ticket comes in, will you consult with me on it? Because I would like to just look at the roles with the group while we're doing that, just to make sure there isn't anything else going on.
Absolutely.
Thank you.
Okay, the next question comes from Trista. Trista, your line is unmuted.
I have two questions. My first question is, when we are creating a staff assignment, there's a little box to check that says primary assignment. So I'm just not really sure if we should be checking that, or when we should or shouldn't be checking that. I'm not sure if this pulls in with the person who just asked a question as well, because it got me thinking, like, oh, if someone has a DD case manager, and we didn't select ourselves as primary, if that's why it would pull the case manager. I'm not sure, but that's my question, is when do we check that box? When do we not check that box?
So I'll try to answer that one if I can, as best as I can. And I do think it's something that we're all learning. From my understanding, primary's only function is to basically set off notifications. Currently, we don't have notifications turned on, but if you were the primary on and someone assigned you to a case and you were the primary, then it would notify you you've been assigned. So as far as I know, the only functionality for primary is around notifications.
Okay, so we don't necessarily, it doesn't really matter if we check it or don't check it.
Well, you might want to if somebody else wants to then look at the record later and is trying to figure out who is the main contact, because it does allow people to see that. And so, right, so it's kind of like thinking about workflow long term. Like, yeah, it might not be functioning now, but what kind of habits do we want to put ourselves in so we don't have to unlearn something? And so I would have you think about it like that.
Okay, so it makes sense then, like if we're the care coordinator, they don't have any other case managers to select with primary, but if a person has a case manager, should we best practice not check ourselves as primary if they have a case, like a case manager?
Primary can be per role. So
Okay.
I think you can choose a per role.
So just always click it then.
Yeah, I think so. I can't think of a reason not to. If we start seeing functionality issues being caused by it, then we can work that through. But I haven't seen anything to date.
Okay. My second question has to do with, you demoed the revising a support plan. I am just wondering, how do we consider a support plan closed? Like, is there certain fields we need to fill in, or do we need to change the dates of the support plan when we revise it? What boxes need to be checked to consider a support plan closed?
So support plan has to be in that approved status to be closed. And so that would mean all the completion requirements were met. Otherwise, it would not close. It would not move to that status.
Right, but an active support plan would be in that status too. So like if a person passes away, for example, and we're closing them out completely, do we just leave the support plan how it is, or do we create a revised version of it and indicate somewhere on it that the support plan is ended?
I'm following you. Because to your point, your support plan has a date that exceeds what potentially the services were for the person.
Right, or someone's medical assistance ended and they no longer have services. How do we consider a support plan to be completely ended?
So, Kathy and Rakia, do you have anything that you would add to it? Because I'm thinking about this. So, let's say Caroline Ingalls doesn't have services anymore, or MA has passed, or isn't available anymore. The plan would just stay plan approved, and it doesn't need any revision to it, correct? You don't have to change the plan dates or do anything to it.
I was struggling to find my mute button, and my mute button is at the top of my screen. Oh my goodness, I'm so sorry.
Okay.
I'm wondering if that's an MCO decision. Sue or Debertina, any guidance on that, or are we just talking?
Well, this is Sue. She used the example of a waiver ending. I mean, that wouldn't just be MCOs. That would be, is there
Okay.
what is being done?
I recently had an individual who was on a DD waiver pass away, and so I just kind of did it how it makes sense to me, and I created a revised version of the support plan, and then when you put in the dates of the support plan, I put an end date of it as of the date that he passed away. That just what logically made sense to me, but I really didn't know if that was correct or not.
Well, and then the other piece to think about, right, is that you then unassign that person from yourself
Mhm.
and do it from the location. And I think in there's a opportunity to say the person is deceased, is what
Yes,
I'm
I did do
remembering.
that.
Yeah.
Yes.
Yep. And so
Yep, I
that's really where,
unassigned him
yes,
there.
yeah, so that's really where your trail finishes, right?
Okay. I think I'm just so trained on our collaborative care plans that we have to close it and put an end date on it. And so I'm trying to translate that into MnCHOICES. And so on a support plan, I feel like I need to close it. And just if we don't have to do anything with the support plan and just end the location and staff assignments, then that, I can do that. I just wanted to make sure I was doing it right.
I don't have a specific answer for that. I think I'd have to take that back. Yeah, I think Teresa will have to take. In terms of the functionality of the support plan, you can do exactly what you just said.
Mhm.
But you're asking more of a policy. Your question is kind of both functionality and policy, I think. I just am not confident on the second part of it without checking into it a little bit further.
Yeah, and thanks for the question, because like Kathy said, you will hear me say, yep, from functionality standpoint, here's what you could do. But policy always
Mhm.
reigns over functionality, as you all know. So
Right. Well, those were my two questions. Thank you.
Okay, so the next question is from Melissa.
Question is very similar to Sheena's, except it has to do with the assessment. So we have a CADI annual due, and the person is over 65. So the lead agency is opened as a certified assessor. And the health plan has their staff assignments listed as care coordination and certified assessor. And the lead agency did the MnCHOICES assessment, the MCO did the HRA assessment, and the lead agency were struggling because the assessment in the assessment detail section is pulling the assessor's name as the MCO's name and not the lead agency assessor's name. So we're doing the CADI reassessment and revision, and it's pulling in the health plan name instead of lead agency. So I'm wondering if that is a technical thing. I have not submitted it, if it needs to go in as a ticket, or if there's something that either lead agency or the health plan are doing inaccurately.
I think that's what we were hearing earlier, and I would put it in as a ticket.
Okay, thank you.
And part of the reason for it is, I mean, we'll want to look at it from functionality, but I also want to test it to roles to make sure there isn't something sitting back there that we're not aware of. So I'd like to check it.
Okay, the next question comes from Sophia. Sophia, your line is unmuted.
Questions. One is just a review on the care plan or the support plan and the PCP not auto-populating on the support plan. I was trying to look at your slide really quick. Am I incorrect where you said we have to enter it twice on the HRA for it to go over to the support plan? That's my first question.
So Kathy, what I saw was that you entered it in the contacts and marked the PCP as part of the interdisciplinary team, and then it was available in the drop-down menu. Am I thinking about that correctly?
Right, but I wasn't in an HRA support plan. Let me see if I have one that I can pull up. I'm not sure. Like Teresa said, you enter it in the contacts. I don't think you enter it twice. But so you enter it in contacts and then it can pull into the support plan. But maybe that's what you're meaning.
Yeah, well,
It doesn't,
it is on the HRA, but when they go to do the support plan, it doesn't pull into the support plan. Do they have to pick it in the support plan then? Where it auto loads in the HRA, but it doesn't auto load into the support plan.
so this is a HRA support plan.
So Kathy, what I saw you do for the support plan that's for the assessment is that you chose it from the drop down menu. That it didn't auto populate. That's what we're hearing her say, right?
Yeah, correct. Yep. You have to, it doesn't auto populate. What's different in the HRA support plan versus the one I was showing, is there is this primary doctor field in the HRA support plan. But what's in here is just the primary doctor and then the date the doctor, you don't have to, I don't believe this is a required field. Oh, it is a required field. So this is here. And that's different than the other support plan, but in order to get all the information about the doctor, yes, you would have to add the doctor. I'm going to add Dr. Baker. And we shared the support plan today. And then Dr. Baker's phone number is.
Okay, so
And then
adding it there. Okay.
yeah. Does that help?
I will bring that back to my care coordinators and remind them to see if that's what they're doing. Otherwise, I
Okay.
can put in a ticket. And then I have some questions about the support plans.
Can I just ask a quick question? If what would the ticket be?
Well, if they say that they're seeing it there and it's not loading, then that would be a ticket, right?
If they're seeing it, if it's in the contacts and then it's not loading? Or
Yeah.
yeah, so if they're saying it's in the contacts but it doesn't load here, remember, ask them to make sure that in the contacts, all of their contacts have a first name and last name in that field.
Okay.
Because that will be the same thing for the doctor in the HRA support plan. If there isn't a first name, last name in every contact, then that doctor will not load.
Okay.
No one will load.
All right, I'll let them know about that.
Yeah.
And then on these support plans, or actually real quick on the HRA, so how we could go in and click revise on the support plan. Are we able to do that for the HRA if they find they've made a mistake? So like they approved it and then they noticed that they put the wrong, for some reason, there's a wrong date somewhere. Are
For
they
the
able
support plan or the HRA assessment?
on the HRA?
Yeah, and
Because-
I can speak to that. So right now, no, we don't have the functionality with the health risk assessment to be able to revise it. And so once you've marked your HRA as complete, the only option that you'll have to be able to go in and change whatever needs to be changed is that you'll have to create a new HRA form and have that information copy from the previous assessment over to that new HRA form, make your edits, and then close that out again. So you won't see that revised option with the HRA form.
Won't that confuse the system because there could be two HRAs and how would they determine which one is correct?
Well, it goes by the date created. I don't know, Kath, if you still have your screen up. When you create a new form, it generates a new date, and so you will be looking at that latest date on that
Okay.
form page, dashboard page.
Okay, because I didn't know, like when we were entering them manually in MMIS, you would see two, and I just didn't know if because in the beginning, a lot of our care coordinators were, if they did an assessment, but they didn't complete it, or they didn't actually go in the system to enter it until the next day. That same date, the date that the HRAs opened, that date's on there, and they weren't noticing that. So let's say they did it on the 9th, but they, for some reason, didn't go into MnCHOICES to start their assessment. It would put the date of the 10th on there, which would be incorrect, especially if it's a compliance. It would look like we were out of compliance. So then they would have to go back in and enter a new one. So I wasn't sure if it's going to be really confusing when we get audited.
Yeah, and I do want to remind you that for the HRA, you're no longer having to enter that HRA data into MMIS.
Yeah, we know
Does
that.
Okay,
Yeah.
okay.
Yeah. But I'm just wondering, like, if when we're audited, you'll see 2 of them. And especially like if they catch it on the same day, that could really, I guess, just look for the latest form ID number or the oldest looking form ID number. I'm just a little worried about how are we making sure we're gonna be pulling the right information.
Mm-hmm. Yeah, so they would be looking at that last created date, and then the date, I mean, it also has when it was last modified, and so they will be looking at that latest date. And I know there are plans to have a training with the MCO audit team on what they will be looking for when they do go to complete their audits, and so this could be a part of that training as well that we're communicating with them.
Okay. And then on the support plans, we were noticing, so you said we can revise it. So for us as an MCO, we do quarterlies and we have to update it when we have transitions of care. So we can go in and revise it multiple times during the year, correct? We don't have to. So there isn't a limit on how many times we can revise it throughout the year.
That's correct.
Okay, perfect. Because at first we thought we had to do a new care plan every time, and that just really seemed weird. And then we are noticing, or where a lot of my nurses, our care coordinators are getting hung up, is when they're doing the support plan and they're doing the supports I requested, they'll enter a goal. And then when you're down there, yeah, if you could show it on the screen, maybe I can explain it. Or if you go to my goals section first. So they'll write a goal. And so they have the goal statement. And then when you get where it says selected supports I requested, they just can't go there and enter it. They have to go to like supports I requested and then enter something in order for it to populate there.
Yep, that is correct. That is its functionality.
Okay, do you know if that'll change? So it's because it's kind of hard because then they have to remember what the goal is, or is there some kind of guidance on how we should be filling out that supports I requested field, just so we make sure we're doing it correctly? So first they're entering all their goals, and then they go to the supports I requested, and then entering things in there.
Yeah, and then they go back to the goal, choose the one that applies.
Okay, so it can't be generic, like community health worker will assist member with transportation. Does it need to be very specific to what the goal states?
So
is
do you
it a
see
policy?
the little do you see the little light bulb that's next to selected supports I requested? I'm thinking that there must be one on the other side too. So that
Yeah.
those are helps. And so
Yeah, and
when
I've
you
been telling
wonder,
him to look at that.
okay, cool. And what Kathy is getting ready to show you is they could write goals and write the next piece at the same time, do them side by side. So write the goal, do the supports I requested, then go to the left and pick it, then go back to the, create a goal, do the split screen again, and just go back and forth between the two screens. And they're on the same form while they're working on it. That's what she's showing.
Okay. All right, I will let them know that. So there isn't any thought that maybe in the future that could be changed where they could type the goal and then just fill that box out instead of flipping from screen to screen or doing the side by side.
Yeah, this is the functionality of the application, of the larger application.
Okay.
The one question I have is, would it be helpful to them to do their supports first and then do the goal section?
Well, I thought the supports pertain to the goal. So if the member needs a dental appointment, then usually it's the support would be, you know, Jane requests assistance setting up a dental appointment, and then the description would be or community health worker will assist member scheduling dental appointment. And so it kind of depends on what the goal statements are. So I don't know if they could pre-make them or not.
So if you put that in under the supports, oops, wrong one. Dental appointment, and then went back to do the goal.
So yeah, set up annual dental appointment or something, whatever that is.
Oh, sorry, I have to make my goal statement longer. I'm just gonna put in X's. It doesn't have to be much longer, but just a smidge. Would that be helpful?
Okay, so maybe having him doing it on a split view might be the easiest thing.
Split view or do, because what I did was, and you don't have to be in split view to do your supports first. And then go back to the goal. Because then if you go back to the goal, your supports would be there.
Okay, yeah, I think the split view might work better for them, but I'll let them.
Yep. And I would encourage people to go into MTZ and play with different, you know, what, so that different options of what works better in terms of the functionality of the system.
Okay. That's all. I had a question about reports, but I don't think that's for this call in, so thank you.
Okay, so then the next question comes from Dorothy.
I just have a couple questions. I'm a little confused about the support plan. After we submit it, what if it's denied? How are we notified of that? Or how are we notified it's approved? Do we have to check?
I'm sorry, I couldn't hear the question.
So when we submit our support plan, and then how do we know when it's approved or denied? Do we get some feedback on that, or do we check it? Can you hear me?
We
Yes,
can hear
I
you.
can hear you. Yep.
Okay.
Yeah, are you talking about the status options that it provides? Because those fields they're manual.
Well,
So
I just know when we submit the support plan, it says submitted, and then it has to go to DHS to get approved? And then what if they don't approve it? We have to,
I guess I'm gonna let somebody else on my team speak. I was not aware that, I don't think that.
I don't know of
DHS
any approval of
No.
support plans at DHS for any of the MCO support plans.
I think that
Okay.
this is a question about how the statuses read, and maybe
Yeah.
that is some assumption that's made that there's an interaction between the support plan and another system.
Yeah, I was just a little, or thinking that that could be the case, so. But once we have it submitted, it's submitted. To that.
Yeah, so when you do submit, so the piece with the status for support plan, when it says submit, that is just that's just the action that's required to move it to the next status. That naming convention is causing you some confusion, I'll say, because you're thinking it's submitting it to some place, but actually what it's doing is it's notifying the system to change the status. So I think the issue you're having is with the language usage on the status drop-down menu. Because it isn't sending it anywhere for us to review and approve or not approve. It's just moving it to the next status. So I just want to make sure that am I understanding your thinking correctly?
Yeah, it sounds like it. I thought that we would get feedback on it from somewhere in the, that they monitor that, and then if there's a problem, then they send it back. Like if we
Nope.
forget, well, I know if you, yes, you won't forget anything because you look at the completion.
Yeah, so all it is doing, what Kathy's showing you, is it's just moving it to the next status. So it's moving to the status. When you hit submit, it's just changing the status of the plan. And so no one will actually review, approve, or whatever your plan. It's just moving the status of the plan.
Okay, and then I had one question about the signature page. Where, if we get that manually done and we upload it, I've been told a couple different things. Do we upload that into the forms? Or I also heard that there was a spot under the signature page to load it, but I haven't seen that, so.
So
Oh,
what
I see.
Kathy's showing you is when you pick handwritten, it then lets you load the signature directly into the
Okay.
support plan.
Thank you. That's all I had. Thank you.
You're welcome.
Okay, so then the next question comes from Kelly.
Couple questions. One of the questions, since we were just talking about the signature, is the digital signature approved? When for the new care plan, or for the signature page for the MnCHOICE, when I was trying to get my original signature, it wasn't working, so I did a digital signature. And is that appropriate? And will that work for future?
Can you explain a little bit more about what you mean about a digital signature, please?
For our care plan signature page for MnCHOICE, on UCare, we have the new support plan sign sheet, MnCHOICE PDF. It's what we are sending to our members. And at the end, it's supposed to have my signature. And I did a digital signature instead of like an actual physical signature that I did. Is that appropriate?
So when you say digital signature, are you using a signature pad, or are you using a digital signature that gives you a date and time and whatnot?
Gives me a date and time, and it has my email.
Thank you. That just helps for clarification. So go for it, Kathy.
I think I might have to have Sue and Deb and Tina, because I'm confused because you're talking, from what I heard, and I might be misunderstanding you, is that you have a different signature page that you're required to use for MCO. Is that what you're saying?
Yeah, it was under the health plan, UCare site, our new signature page. And it
Oh,
has all the
we're gonna have to go back to that because I don't know why there would be a separate signature page.
have
Yeah.
my organization submit the support plan. It just says the support plan has Minnesota Department of Human Services, MnCHOICE support plan signature sheet. That's where we put our members' names. It has the materials shared, creating my.
Oh, are you talking about the new one that was
Yeah.
issued as is in the help center?
Yeah.
Oh,
Okay. Yeah.
that's limited use.
Yeah.
Maybe
Yep.
you can explain that document. Yeah.
Yeah, so that document should only be used. That document was meant to be used in special circumstances. That is the exception, not the rule.
Okay.
So this signature page is what I believe that you are referring to. Let me pull it
That
up
one right
here.
there. I believe so.
I'm not sure if you'll be able to see it. I might have to reshare. Do you see this?
We
do I need
we
to-
can see it. Yep,
Okay.
we can see it.
So this signature page should not be used with every support plan.
Okay.
This signature page is only supposed to be used when people, the purpose that it was created for was when people are going out to visit somebody and they don't know what program the person may qualify for. They don't have any idea, so they don't know what support plan to be creating before they go out.
Oh,
So the hope was that, and then I'll get back to your question about the digital, which I might have to take back, but the hope was that this is how people are obtaining signatures. That when you go out to visit with the person, you would take offline the assessment and the support plan, or, you know, whatever you're doing, and using this as, to obtain signatures.
okay. And I
So,
will take that back to, we have support people that do the signature part, and I will clarify that. What some of us are still transitioning into seeing members, our members have that have been a mentor have been doing it these over the phone for those that refuse to meet in person. Is there is it the same thing where we're supposed to get this signature page that you're showing me now, or is it with the one we just reviewed? Would that be the option for those that did it over the phone?
they're doing the support plans over the phone, you're saying?
Yeah.
It would be using this, you can print out, because wouldn't they be sending them the whole support plan so that they could review the support plan and they would know what they're signing?
Yes, I think there was maybe a confusion with this new document. This is the first time I was requested to do the signature page.
Yeah.
So I will
Yeah.
clarify that that is not the appropriate one. This is the first time I've ever had that signature page that we just
Yeah.
reviewed. It wasn't appropriate.
Yeah, no worries. And you know, we're all getting used to different things. So no worries. I mean, it's just that we're hoping that people will use the system as it was designed. And that's the hope, is that that will make it easier for people. And
Okay.
then to your question about digital, I guess I'm gonna need to take that back because I've never been asked that question before. That's a good question. I don't have a good answer. So so basically what it is it's like your name is typed and it's
Yeah.
got the date and your email.
Yeah, it was basically what we were doing for our Oprahs beforehand. It had that digital stamp. But that question only came up because I was introduced to this form this morning, and I was
Yeah.
trying to figure out how to enter the signature on that form. But
And
okay.
it could very well, we'll take that back and talk about it, but that might be an MCO specific question too. I'm not sure.
Okay. And
Thank
then
you, though.
Earlier, when we were first doing trainings, when we were adding people, let's say an emergency contact that we didn't know the address, we were told to just put lives with person if the person didn't want to share. Is that something we're still doing, or are we able to enter people without confirming their address for my support interdisciplinary team, please?
Rakia, correct me if I'm wrong, but I believe that that's still, the address on contacts is still a required field. And so I believe that you are correct that you would click lives with, but then in the comment section on the contact, you would note that, the person has a different address, that they don't live with the person. Rakia, correct me if I'm wrong, but.
I think that's accurate.
Okay. And I just have one more question. Since we were just kind of found out about on the support plan, the doctor's phone numbers did not transfer unless we did it in the comment section. If there are care plans that have already gone out, is it something that we can have our care coordinators go back and edit? Or do we just, moving forward, we make sure that they have the phone numbers in the comment section?
Are you asking in terms of audits, or are you asking just in terms of functionality?
Well, just in audits, I did not realize when I was submitting my support plans that unless I had the doctor's phone number under the comment section, it wasn't on the member's support plan. So I'm just wondering if I should go back, or just going forward, just make sure that if we want those phone numbers on the member support plan, that we put it in the comment section.
I can start by answering in terms of functionality. The audit question I would have to take back. So in terms of functionality, yes, if you would like it in the actually on the support plan, but the support plan has been moved through the whole process, or submitted through the whole process, and it's a final version, you would have to go in and do the revised functionality and enter the doctor with the doctor's phone number, or whatever you wanted to put in that comment section. In terms of the audit, I have to take that back because I don't want to give you.
Well, I would, are you a delegate of a MCO?
Yeah.
I would consult with the MCO as to whether that's something that they specifically audit for and would expect, and how they would be auditing you for that this year. And I would also add is that if it's important information you believe for your member, for them to have that number on their support plan, then I would certainly add it and resend it out.
Okay. Okay. Yeah, typically our members know, but I was more looking at the audit perspective of if we didn't have it, not knowing that function.
That's why I would, as I said, I would consult with your MCOs as to what their expectations are for that and how they'd audit it. And like you said, it may be case by case for members, but there may be members that that's a very important thing for them to have and for you to be able to point them out to. So.
Okay, wonderful. Thank you so much.
Okay, the next question is from Alyssa. Alyssa, your line is unmuted.
Thoughts on what should be or could be done if a care coordinator finished a full support plan for the MCO MnCHOICES assessment instead of a support plan for the HRA assessment that she may have done? We reviewed it and it doesn't look like there's a ton of differences or any differences, but is there a way to transfer from one to the other, or should the incorrect one be discarded and the correct one be completed?
I can answer part of your question. Part of your question, the functionality of it is it would not, like the MCO support plan does not transfer over to the HRA support plan. In terms of what should be done, I'm gonna defer to somebody else on the call, or we may have to take it back.
I was going to say, it feels like to me that that's a help center, the help desk question, because you're going to have to ask policy resolve what you want to do and if you need them to add notes to anything, or right.
Okay, thank you.
Okay, the next question comes from Katie. Katie, your line is unmuted.
I'm wondering, when you're completing a support plan for on behalf of a health plan, and the member is also receiving waiver services, is it best practice on the support plan to be including all those waiver services when you're just completing the HRA and they have like a CADI or a DD waiver?
So did you guys put out direction for that in something written?
I don't think we have yet. I know we've had the question about, is your question about how to do it, or is your question about if you should do it?
Well, both. If you should do it is my main question. I believe if you're going to do it, you're supposed to put it under the, I believe it's the services and supports section.
Are you once again a delegate of an MCO?
Right.
I think you need to consult with your MCO as to what their expectations are for what is included in a support plan.
Okay.
And you know, I know many MCOs consider it a very inclusive document to record all the services a person is receiving, not just those being paid for by the MCO. And then I do believe that the where is folks help me, what is the name of it's other people and others
So yeah,
organizations that support me, right?
Yep, there's people and community organizations that support me section. And then there's also services and supports section. One section, the services and support section, that has rates tied to it. The people and community organizations that support me does not have any rates tied to it.
That makes sense. Thank you.
Okay, so then the next question comes from Rebecca. Rebecca, your line is unmuted. Oh, I see she just lowered her hand. Okay, so then the next question comes from Michelle. Michelle, your line is unmuted.
Can you hear me?
Yep, you sound a little bit like you're in the shower talking far away and kind of echoey, but we can hear you. So if you speak up just a little, we should be okay.
Okay, I promise I'm not, but
It's all right.
For MCO HRA support plans, is plan ready the final status? Or is there a plan complete?
Yeah, I knew someone was going to ask about the statuses. They are listed in the practice guidance support plan. It does need to be updated, but plan.
The final status is plan approved?
Thank you.
Is that your question? I'm sorry.
How does it get to be approved? Yeah, how does it go from plan ready to plan approved?
You do submit again. You
Yep.
choose submit again in the drop down menu.
Yep. Do you want me to show that? I don't know if I have
I know I was looking to see if I had anyone that had all
if
the
I had
completion
somebody ready
requirements.
to submit.
Yeah.
Let me see if I can show you almost.
You know,
Go ahead.
no, it's okay. I'm gonna go look for the status list, Kathy, while you do that, okay?
Sure. That'd be great. Thank you. So my problem is I don't know that I have a support plan. You know how our completion requirements have to, oh, look at this one. It's almost there. So let me just see if I can add something to that and then we could go through all the statuses.
And so while you're doing that, do you mind if I quick share and I'll put the statuses up?
Sure, absolutely.
Oh, you know what though? Hang on. I might have the old screenshot of it. Hang on a second. You keep working. I'm gonna go dig a little bit more.
So you can't find machine to see.
Can we ask another question while you're waiting?
Absolutely.
When you had talked about the PCP contact information and that some of that information is required, can a yellow bar be added to show that it's a required piece?
So I'm not sure. Oh, I see what you're saying. So you mean, let's see, I think that was in the HRA support plan. Are you talking about right here? Oops, sorry. I just clicked out of it. Are you talking about right here?
It's in the contacts.
In the profile. Or are you talking about this part where I said this was required? When I took the date out here and I tried to save it. Oh, now it's saved. The last time I did that before, I thought it made me have a date here. But you're talking in the profile?
It was even right there because previously you said it was required, so.
Yeah, I don't know if that was just a fluke or why it did that to me because I do not, if it's required, yes, something will pop up saying it's required.
So let me talk about that for a second.
Sure.
So in the completion requirements of any form, it'll say here are the things that are required. You'll see little asterisks by them. When you open a section and fill it out, it may have requirements for that section, like that, a pop-up comes up and you're filling out a person's name and phone number and whatever. Again, it'll either have a yellow bar or an asterisk by it, but it's only required because you opened that box up and chose to use it. So it's not a requirement of the form, it's a requirement of the window that you're currently in. And again, MnCHOICES will tell you, yes, you need to provide it, or no, you don't. But you should see on any instance where the window comes up and you're filling it out, it'll either have that yellow bar or the asterisk next to it to tell you it needs to be completed. And then if you don't, it will tell you you need to do this. But it doesn't necessarily mean that that window is part of the completion requirements.
Yes, it's selected barriers there.
I'm sorry, did somebody have a comment right here?
Okay, so another question, when you were creating that goal and it didn't have enough words and then you added X, 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 X. I mean, do the goals have to have so many words to be acceptable?
So it's not very long though. If you'll notice, it's only, if I would have done a complete sentence there, let's see, I think I'm in the wrong, I can't change, I think I have to change my status, my,
So that's okay, but you're just saying it does have to be so many.
Yeah, but if you notice, if I would have just done a full sentence there, if I would have said the person needs a doctor appointment or a dental appointment each year, it would have been fine. So it's not that you have to write a lengthy goal. It just has to be, I think it's 30 characters, but 30 characters is not very many.
So, in just one other comment is that when there's questions and DHS recommends to send a help ticket in, then that doesn't answer the question for everybody else that's on the call.
That's correct.
So if, I don't know if, there's Q&A, FAQ documents that go out from these call-in sessions that would be helpful to everybody that's on the call that has the same question.
Yes, thank you.
Simple questions. Oh, did you,
So-
how about the status?
Yep.
Thank
So
you.
you can see, I was trying to make sure that my completion requirements were done, and what I had done, the error that I had made was I had chosen that there were barriers, but I did not have my barriers filled out. So that's why I had a completion requirement that was not done, but now we're at the point where I could submit this. So you go up here to the status right now is in progress, assessment complete. And I just want to pause briefly to remind everybody, if there's the first status is in progress, but if you leave it at in progress, you will not have the assessment information pulled over. So once your assessment is complete, it should be submitted and moved. I mean, I know submit is confusing people. So let's say submit and move is the same, means the same thing. But if you click submit, it'll go to in progress assessment complete. I have answered some CRM, some tickets recently that people move it to assessment complete before the assessment is complete. And they're wondering why the information has not pulled into the support plan. But the answer is because the assessment is not complete. The assessment has to be at a point where it's complete in order for the information to go over to the support plan. But at any rate, the next status, in order to move it to the next status, you hit submit. Are you sure you want to submit the support plan to plan ready? You hit continue. And you can see where it's at plan ready. You hit submit again. It's going to ask me the same thing. Are you sure you want to submit it to plan pending? Hit continue. And then you hit submit again, and this will finalize the support plan. Is there a question before I move? Because if I hit this, then it's going to finalize it.
Kathy, go to cancel for a second, will you please? I want to show something. And then will you go back to status? So let's say you move this status all the way to plan pending and you're like, oh, heck, we do need to make a change. This is an opportunity to choose request clarification. And when you do that, it will move, go ahead, do that. Yep. And it will move the status back to in progress so that you can then make any kind of change on that. And then again, you submit to move it back through the statuses. So the only purpose of submit is to change the status so that anybody who is looking at the form knows where it is in the process. And so if they need to go look at it or work on it, they're aware of where you are in your workflow.
So within the support plan, at what status can you not edit it anymore?
Plan approved, the last status. Mm-hmm.
Can it stay at plan pending or does it need to go?
No, it has to go plan approved because you have to, I mean, if you think about this, and sorry if I'm speaking out of turn, folks, but I'm just going to speak from a functionality standpoint only, okay? And then policy can jump in. The reason why you do that is you need a point in time for that support plan. You need to capture it and kind of enclose it. And if you know that, yeah, there might be changes later, that's what revision is for, is to choose revised and then updated. So that's from a functionality standpoint why you do that, is because you need to capture that point in time. And then policy, if you want to talk about that purely from a policy standpoint, you'll jump in, because I don't want to overstep my purview.
I think you did a good job, Teresa, too. I think also there may be some, when we're running reports, if the support plans are not in the final status, they're not gonna pull up that it's finalized
So
in a report.
one clarifying question, I thought you had said we couldn't revise and we had to create a new.
I'm sorry, I don't understand.
Did you say previously we couldn't revise the HRA support plan? We could only create a new one and it pulls the information forward?
Sorry, yep, you were speaking to a support plan for an HRA. Yeah. So there isn't revision as an option for support plan HRA. That's what she's referring back to. So they can't use revise. So for support plan for an HRA, if they mark it plan approved, the only way they can make changes to it is to create a new support plan HRA. That's the question.
No, I think for the support plan HRA, so the support plan other, Kathy, if you want to filter that, you should have the ability to revise your support plan HRA.
Let me go back. I'm sorry, because I'll have to look at, do I have one that's?
Oh, you'll need.
Yeah, I don't have I don't have an HRA, I believe that is completed.
Because it's discarded. Yeah, so I think what we were saying earlier that you don't have the ability to revise is the HRA assessment. So there's not, if you're in your HRA and you've already changed the status to complete, you've completed your HRA assessment, you won't be able to go back into that assessment and revise it. Now for the support plan HRA, you should have that ability to revise the HRA support plan. It's just the assessment itself that you won't be able to revise. You would have to create a whole new assessment and then have that information from the assessment copy over.
And here is, I just finalized it. Here is an HRA support plan in plan approved. And I filtered, I'm just gonna make sure I filtered. So I filtered it, and then you go here and you can revise.
Yep. So there's a difference between the HRA, the assessment, and the support plan. For the support plan, you'll have the ability to revise it.
Okay, thank you.
And then one more question, and this is with like an elderly waiver, so a MnCHOICES support plan. How do you delete a service in a support plan that's not completed?
So let me see, let me get to the support plans. Let's see here. I'm sorry, so can you please say that again? So in a support plan elderly waiver, when you're in a service that's support
How would you delete that service if you accidentally added the wrong one?
So if I had a service here that I had added,
If it's still in progress.
I'm sorry?
If the plan is still in progress.
I'm not sure it'll let me save this. Let's see, I'd have to go through and actually save one. Yeah, I don't even know if I have waiver providers set up for this. So you're saying you're having a hard time, like you made an error and you're having a hard time deleting a service?
Yes.
I think what I'll have you do, have you submitted that? As a ticket?
No,
Oh, no on ticket.
no.
No, I mean, as a help desk ticket?
No.
Could you please submit that as a help desk ticket? Because I would need to investigate that, and I think that would take up more time than we have here on the call.
Okay, thank you.
Thank you.
Okay, the next question is from Allison. Allison, your line is unmuted.
Hello, this is Allison. I had a couple questions. One regarding the RS tools. So currently in MNSP, there's a printout of the RS tool that we send to the CLS provider. And I'm not seeing that in the revised MnCHOICES application. So I'm just wondering if there is something that we should be sending to the provider specifically for the RS tool.
Yeah, Allison, and unfortunately, we don't have Amy on the line, who's our contact person for the RS tool. So you may have to submit that question into the help desk, and then we can route it over to Amy to provide you a response on.
Okay, sounds good. I do have another question then, if I could ask that instead. Just regarding the provider signature. So we're kind of trying to work through that provider signature workflow and requirements and have a couple of questions. One is that documentation for obtaining the provider signature for the support plan required in the revised MnCHOICES?
So can you say that again? So are you asking if you have to show that you received provider signatures in revised MnCHOICES?
Right.
I don't believe that we changed the policy on that. So yes, I would say that you would have to show provider signatures unless somebody else wants to correct me if I'm wrong. Did you have to, so you're saying you showed provider signatures in the past?
Yeah, I mean, we're just shifting from obviously our current workflow and we document that internally over to the revised MnCHOICES. So I'm just trying to, I'm not aware of a lot of conversation around the provider signature. So we're just trying to work through that workflow and get some direction.
Yeah, because there is, it's on this, it is on the signature page with provider signatures.
Yep. Okay. And then I guess just to kind of go along with that, the statuses, of course, are new to us and working through those statuses. And so for the provider signature piece specifically, would we just leave the support plan open in an in progress status while we wait for that provider signature piece? Because, we send out the request for the signature, we wait to see if it comes back. If it doesn't, we send the second attempt. So it does take a bit of time. So do we just leave that open then until we can complete all of those attempts or receive the signature back?
I can speak to functionality, and then if there is a MCO policy piece to this, I'll defer to somebody else on the line, or we may refer you to your MCO for that. But in terms of functionality, in order to attach any signature, like if you got a paper signature back and you wanted to scan it into your computer or whatever, and then attach it to MnCHOICES, yeah, you would have, the support plan would still have to be in a status other than approved. Does that help in terms of functionality?
It does, yeah.
Okay.
It does. I guess I'm still just kind of wondering what the appropriate workflow is. And I guess just kind of trying to work through these statuses a little bit more as far as how long we should be leaving it in progress. I know we have our timelines to get a support plan out to a member within 30 days, but then, you know, in general, how long should we even be keeping them open past that? So it helps, but I think I still have that same question.
Right. And we may need to take that back, because I don't think that we can answer that now. And, I'm also wondering if your MCO has guidance, you know, specific, if that would be different for every MCO. I don't know.
Okay. And then just one other question regarding the provider signature. If a member is requesting a partial support plan to be sent, I'm wondering if we can get some direction on, you know, what we are sending to the providers for a full versus a partial.
And what did you do in the past?
Well, we have it set up internally to, you know, provide out the partial requirements, but it's different now that it's in the revised application, so we don't know how that works.
So, I don't know if this is helpful for me to show. Are you aware that you can print different sections of the care plan or the
I did
support
just
plan?
recently play around with that, yes.
Yeah. So I'm not sure if that helps answer your question, and I can show that if others aren't aware. I'm happy to show that real quickly. I'm not sure if that's answering your question, if you're already aware of how to do that, but since we're here, I'll just show it quickly. So you go to support plan print. I'm hoping all these things are popping up on my screen. And then you click here too, and you can see all the different sections of the support plan. Lots of times what I do when I am doing testing is I'll unclick the select all, and then I'll just go through and click the different parts that I want to print out. And then you have to hit preview first. Oh, oh dear. Oh, okay. Oh, let's do that again.
Yeah, and I did play around with that, and that was helpful. And, you know, we can talk internally too. I guess I just was wondering if DHS had any direction as far as what pieces we should be pulling out for that partial support plan. Since we're just kind of getting to know, you know, this new application and the new support plan.
Right. So I think what we could help you with is if your MCO says that they want certain things sent out and you don't know how to print out those certain parts, certainly can help you with that. Again, I'm going to either defer to somebody else on the line, or we may need to bring it back to you, or it might be MCO specific about what exactly they want sent out to the members. But in terms of functionality, we're happy to help you find where that is and how to print that specific part out.
Okay, thank you.
Mm-hmm.
Okay, so then the next question comes from Emily. Emily, your line is unmuted.
Morning. I did put in the Q&A panel too, just to help answer the question about the person trying to delete services. We had a really hard time with it at first as well, but what we found is when you're on the service, there's a little trash can button and you click it, but then a confirmation button pops up, but it pops up at the bottom of the screen. So you have to scroll down to it because you can't see it right away. So if you scroll down after you hit the little trash can on the service, then there's a confirmation button and you can delete it. So hopefully that helps the other person. It took us longer than I care to admit to figure out that's why we couldn't delete a service as well. I'll give you a second while you're getting your way in there.
Go ahead. You can, I
Okay.
didn't realize I was still sharing. I am so
Oh,
sorry.
that's okay. No, it's okay.
You go ahead with your question. I can keep sharing.
Yeah,
I'll share.
That's fine.
I'll reshare when I
Another
find
one
what
is
you're talking about.
maybe more of, I don't know that there's actually an answer for it today, but there's been some discussion about the submit button and support plan statuses and all of that. Is there a way to make the submit button be labeled as next or something other than submit, since it's causing so much confusion?
So I can answer that question. This is the core functionality of the system, and so we will not be able to change that. But thank you for that question.
Yeah, and then I also feel like part of the confusion is because there are just so darn many of the statuses, and the plan ready and the plan pending seem excessive, I guess. Are those also like functionalities of the bigger system, or are those something that could be considered for removal at some point? I know that, I don't know if it was an office hours or a launch call a while back, but there's discussion that, like, for certified assessors, for example, only the assessor can change the status to plan complete or MMIS approved anyway. So like the pending and ready, like support staff can't even change the status. So I wonder what the point of them even is.
Are you referring to assessment or support plan or both?
All of the above.
All of the above.
The ready and the pending status for any assessment or plan. I'm wondering what the point is, I guess. Like, is there a function to them? If we're just going to keep clicking submit to get past them, is there a way to shorten the amount of statuses that we have to click through?
So I think what we could do is we could take that one back and talk
Okay.
about it from an enhancement standpoint.
Okay.
And then we could talk about, are there any on the list that aren't necessary, or if they are all necessary, to make sure that the practice guides clearly indicate the why each of them
Yeah,
exists.
what purpose they
Which
would
is
serve.
what,
Yeah.
right, which is what I'm hearing you ask. Like, so if it's there,
Yeah.
what's the purpose? And so if we
Yeah,
can,
are we just missing something? If there's a helpful purpose to them, awesome. But yeah, if that could be discussed, that'd be great. So then some care coordination specific things. We have had a couple of hiccups when we're trying to add our member into the system for the first time. We search for them, they show up, but occasionally when we hit the import from MMIS button, it just does nothing. Like, it doesn't go to the next thing. It doesn't, normally when you click the import from MMIS, it thinks for a second and then it pops you to the person's profile page. And one of our staff just had issues where she was trying to do that and it just never went. So is that going to be a problem down the road that the import from MMIS didn't work? Is it going to break anything for just, it's under 65, just SNBC, care coordination, HRA? Like, is that going to be a problem in the future? We don't know, maybe?
Yeah, hi, this is Rakia. I'm just trying to see if anyone else has any thoughts on this. I'm not sure if it would be a problem
Okay.
later down the system, but if you are creating a person, so if the import doesn't work, are you just adding new or creating new? I mean, because if it's just for an HRA that you're creating the person just to complete an HRA for, you're not really waiting on any MA statuses to come over. And so I don't think it's an issue.
Okay. Okay, that's kind of where I landed as well. And
Yeah.
there was one of them, there's two members, two clients that this one case manager is having issues with. One of them, she just like needed to get going, so she just skipped the import button. The other one, she didn't need it right away. And then a coworker tried, also had the same issue. I tried and it worked just fine, which was also interesting. So I'll just tell them to keep an eye out and see if it keeps happening, because we haven't submitted a ticket because we kind of just moved forward. But if we see it happen again, I'll maybe send in a ticket of why is that import from MMIS button not always working. Okay, and then my last piece is I was looking at the training information or the practice guide, and it says, so there's a portion where the care coordinator name is just supposed to auto-populate, and it's in an HRA support plan in the My Care Team section. There's a field for care coordinator. You can't edit it. There's no add button. It's just supposed to auto-populate according to the practice guide. And it had been, but then randomly every once in a while, there's one individual where it doesn't populate. We have the care coordinator assigned as primary worker. We have them, care coordinator is entered in the person's profile, but when we're working on the HRA support plan, under My Care Team, the care coordinator just shows up as a bunch of dashes. Even when we move the plan to approved and print it, like it just never populated. Do we know where that's populating from? Like, did we miss a field somewhere else?
That section might be populating from your assignments area. And
Yeah,
did
they
you
were
say that the
assigned.
assignments were, you
Yep.
completed your location and staff assignments?
Yep. We double checked that because we thought that as well.
Okay. Well, this is one we may need to look into further. So if you can submit a help desk
can submit a
ticket
ticket.
and make sure you're indicating the person ID, we can take a look at it closely.
Yeah, because I think that the plan is now like done and everything, so it'll still show as not listing there. So we should be able to pull that example. Okay, I think I'm good. Thank you.
All right, thank you. So then the next question comes from Tara. Tara, I'm going to unmute your line.
Hello?
We can hear you.
Yep.
We can hear you.
Thank you. Okay, so mine kind of goes, it's not actually a question. I think it's more specific. I think it was the third question, and we were talking about the support plan. Somebody had asked the question about how, like, if they should put an end date on the support plan to actually like close it out, or to end the support plan. And I checked in with our auditor here at South Country, and she had just stated that for DHS, it looks like it's a requirement for seniors only, but South Country actually requires it for SNBC, that the care plan, the goals and the outcome dates are included. And so I don't know if this still needs to go back into DHS, because Sue had mentioned that maybe it shouldn't be MCO specific, but for SNBC, I think that would be the thing that kind of comes into question, because we do have that as a requirement for our model of care.
Okay, thanks, Tara. We can take that back to our special needs purchasing team to have further discussion on it. So thank you.
Awesome, thank you.
Okay, the next question is from Danette. Danette, your line is unmuted.
On the split screen, can you do that offline?
I don't know if the split screen functionality works in offline mode. Teresa, do you know otherwise? I don't think it works, and I think it was intentional, but I'm not certain.
Yeah, so the reason why, let's just think about this out loud for a second, okay? In offline mode, you're taking the forms offline, you're not taking the person's record offline. So you would have to be using split screen potentially for an assessment and a support plan that you've taken off at the same time. And the system's not just set to work that way. You're just taking that basic form off. So, and even with the assessment, only specifically the functional assessment sections are are being taken offline. So no, that's extra functionality that is a part of the system, and it is not part of offline, which is just enough so that you can fill the spaces in and collect the data that you need. So
The other thing I would add too is I think that even if you could use split screen, I know one thing that sometimes gets hard when people are working on their laptops is laptops are usually smaller than when people have additional bigger monitors. I think that that would make it even smaller, the fields that you would be looking at. So I think that would be hard, but thanks for explaining that, Teresa.
Our second question is if they have a transitional HRA, the person prior to their 6-month review, which info would be pulled over into the revised plan?
Sorry, just trying to understand your question. So you're saying you completed a transitional HRA and you're wondering what assessment information is pulled into the support plan or the
For their 6-month, yep. So it's prior to their 6-month. So would it be pulling off the prior assessment or would it be pulling off the transitional?
Well, I guess I don't know, Deb or Sue, if you have a comment on this. Would they be creating a support plan if they completed a transitional HRA? Would they be creating a support plan off of that one, or?
Yeah, that's what was confusing to me. I don't know. I mean, I think the support plan is the support plan. A transitional HRA is just to indicate a change in a product, but you would be using the support plan from the actual HRA that was conducted, not because the transitional HRA doesn't have any data in it.
Will you be keeping the support plan open for the whole year, or would you be revising it after?
Well, I think it would be the support plan, and then, yes, if there's updates to be made, you would go in and revise it. Correct.
So when they
Isn't
have
that what you normally would do?
the transitional is in between, so let's say their 6-month was after their transitional, you would be revising the previous support plan?
You always are revising the previous support plan, aren't you? Even in a 6-month, you're not creating a whole new one, are you?
But if you're revising it, then you're kind of technically creating a new one because you're basing off the information from the transitional.
Yeah, I guess I'm totally, I'm not tracking. I think the question is though, a support plan has to be created off from an assessment. And if you're doing something in between, you can revise that support plan.
Okay. So revise the support plan when there's a transitional.
If it's required. I mean, sometimes a transitional is just done when a person moves from MSC Plus to MCHO in the same plan and the same care coordinator, and it's only been a month. There might not be anything to revise in the support plan.
So when there is a 6-month, when you revise it, will it be pulling information from that transitional HRA?
There is no data in a transitional HRA. A transitional HRA is that you've just reviewed the previous HRA. And it would be pulling it from the HRA that's in the system.
Okay.
Yeah, and I know we're at time. It's after 11:30, and so I don't know if you still have confusion around that. You can definitely submit a help desk ticket, and we can look into it further. And I also see that there are other hands raised as well, and so We obviously didn't get to the remaining questions. So if you have any outstanding questions that we didn't cover today, we do encourage you to submit a help desk ticket so we can get back to you.
We're fine, thank you.
So
Teresa, I don't know if you have any. Yep.
Yep. So let's go ahead and end today's call. But before we do, I just wanted to say thank you to everyone for attending. You asked great questions. We had really good conversation. I think it was good to be able to talk to you and ask clarifying questions. I know it may feel like it's slowing down the process to ask questions, but as you all heard, it's important for us to make sure we understand what you're asking and you understand or can ask more clarifying questions. So again, thank you everyone for coming. Our next call with everyone is at our next office hours in November, the first Friday of November. And then we have another MCO call-in session in December, I believe, because we do every other month. So you will get information about that again as it gets closer. We'll send out information to remind you of that session and the date and time. So, and as well as it was in your communication today, it had a list of the sessions. So thanks everyone for attending, and Anna, go ahead and end the recording, and we will all be leaving today's call. So thanks everybody.